Hello everyone, welcome to the part 2 of oral submucous fibrosis. In previous video, we learned about the definition and history of the same. Today we'll be starting with clinical features. The onset is insidious over a 2 to 5 years. तो insidious का मतलब है जो slowly spread होता है, gradually, पता नहीं चलता है बॉडी में harm हो रहा है, but वो spread होता जाता है. Classifications. So there are different classification, staging and grading systems, based on clinical, histopathological and both. तो इतने सारे तो पढ़ने हमारे लिए पॉसिबल नहीं है. सो इस वीडियो में हम पढ़ेंगे जो शेफर्स में है, which is given by Rajendra R in 2003 and he is the author of Shapers. And histopathological में हम पढ़ेंगे Pringbog, JJ and Sissat SM who gave it in 1966. So as per this classification, it is divided into early and advanced. Let's look at the clinical features of early OSMF. Burning sensation in the mouth when consuming spicy food. तो कोई भी आप स्पाइसी फूड खाओगे तो बर्निंग सेंसेशन फील होती है, पर OSMF के केसेस में थोड़ा सा भी स्पाइसी खाओगे तो ज़्यादा बर्निंग सेंसेशन फील होगा. Appearance of blisters, especially on the palate, तो तलवे में blisters नजर आएंगे. Ulcerations और recurrent generalized inflammation of the oral mucosa. Ulcerations आपको नजर आएंगे और पूरे मुंह में oral mucosa में inflammation फील होगा. Excessive salivation, defective gustatory sensation and dryness of the mouth. तो excessive salivation होता है और dryness भी होता है, so it is a bit confusing. तो actually क्या होता है, initially जो एरिका नट होता है, जो ईटियोलॉजी है OSMF की, उसकी वजह से सलाइवरी ग्लैंड स्टिमुलेट हो जाता है, जिसकी वजह से ज़्यादा सलाइवेशन होने लगता है. लेटर स्टेजेस में ये ड्राइनेस में कन्वर्ट हो जाता है और आपकी जो गस्टेटरी सेंसेशंस है, टेस्ट सेंसेशंस हैं, वो चेंज हो जाते हैं. Periods of exacerbation manifested by the appearance of small vesicles in the cheek and palate. The intervals between such exacerbation vary from 3 months to 1 year. तो चीक में, बकल म्यूकोसा में या पैलेट में आपको ऐसे वेसिकल्स नज़र आएंगे और ये वेरी करते हैं 3 मंथ से 1 ईयर के बीच में. ठीक है, एक बार होंगे फिर गायब हो जाएंगे, फिर 3 मंथ्स के बाद होंगे. Petechiae are observed in about 22% of OSF cases, mostly on the tongue, followed by the labial and buccal mucosa with no sign of blood dyscrasias or systemic disorders. तो आपको इस तरीके के पेटिकियाई दिखेंगे. पेटिकियाई मीन्स स्मॉल डॉट्स हो जाते हैं ब्लड के, इस तरीके से जो दिखाई देते हैं रेडिश. लेकिन इसका मतलब ये नहीं है कि कोई ब्लड डिस्क्रेशिया है या कोई सिस्टमिक डिसऑर्डर है, इसका ये मतलब नहीं है. This may be part of a vascular response due to hypersensitivity of oral mucosa towards some external irritant like erica nut. So ये hypersensitivity का result है जो होता है erica nut से. Pain in areas where submucosal fibrotic bands are developing when palpated is a useful clinical test. तो जब आप palpate करते हो बकल म्यूकोसा को, okay, तो उस एरिया में पेन फील होता है पेशेंट को. So this is very important clinical test. Next is advanced OSMF. As the disease progresses, the oral mucosa becomes blanched and slightly opaque, and white fibrous bands appear. तो जैसे जैसे disease progress होता जाता है, oral mucosa आपका opaque हो जाता है, क्योंकि white fibrous bands धीरे धीरे increase होने लगते हैं, fibrosis होने लगता है, तो ये appearance आने लगती है. The buccal mucosa and lips may be affected at an early stage. ठीक है, तो buccal mucosa और lips शुरू में involve होते हैं. The oral mucosa is involved symmetrically and the fibrous bands in the buccal mucosa run in a vertical direction. ठीक है, the density of the fibrous deposit varies from a slight whitish area on the soft palate causing no symptoms to a dense fibrosis causing fixation and shortening or even deviation of the uvula एंड सॉफ्ट, ये एक फाइब्रस बैंड है यहाँ पे, और ये जो जुविला है ये चेंज हो जाता है शेप में, एक हॉकी स्टिक अपीयरेंस देता है. Acuteness of oral symptoms, persistent recurrent glossitis and stomatitis at the time of recording. Means जो already glossitis या stomatitis है, means inflammation of tongue या inflammation of oral mucosa है, या फिर recurrent है, वो acute हो जाता है, ज़्यादा severe हो जाता है. Sometimes the fibrosis spreads to the pharynx and down to the piriform fossa. तो जो फाइब्रोसिस होता है स्प्रेड होते होते फेरिंक्स तक जाता है, फिर पायरिफॉर्म फोसे तक जाता है. Upon palpation, a circular band can be felt around the entire rima oris. तो जब आप पैल्पेट करते हो फिंगर्स से, तब आपको पता चलता है कि एक बैंड फॉर्मेशन हो गई है. एंटायर रीमा ओरस मीन्स जो माउथ ऑरिफाइस है, माउथ की ओपनिंग है, वहाँ पे एक बैंड फॉर्मेशन हो गई है. इम्पेयरमेंट ऑफ टंग मूवमेंट विद सिग्निफिकेंट एट्रॉफी ऑफ टंग पैपिले. तो टंग मूवमेंट इम्पेयर हो जाती है, ठीक से टंग मूव नहीं कर पाती है. सिग्निफिकेंट एट्रॉफी ऑफ द टंग पैपिले, जो पैपिले होते हैं टंग्स के ऊपर, टेस्ट बड्स होते हैं, वो डिक्रीज हो जाते हैं, मीन्स डीजेनरेट हो जाते हैं. With progressing fibrosis, the stiffening of certain areas of the mucosa occurs, leading to difficulty in opening the mouth, inability to whistle or blow out a candle, and difficulty in swallowing. When the fibrosis involves the nasopharynx, the patient may experience referred pain to the ear and a nasal voice as one of the later signs in some patients. तो क्या होता है, जैसे जैसे फाइब्रोसिस इंक्रीज होता है और वो नेजोफेरिंक्स को अगर इन्वॉल्व करता है, तो आप एक रेफर्ड पेन आपको फील होगा ईयर में, ठीक है. और जो एंड ऑफ नेजल वॉइस एज वन ऑफ द लेटर साइंस इन सम पेशेंट. तो किसी किसी पेशेंट में आपको नेजल वॉइस, जो नाक से आवाज़ आती है. लेट्स लुक एट द हिस्टोपैथोलॉजी. So these are very short points on histopathology of OSMF if you don't want to learn in detail, but these are very important points. So first is atrophic epithelium. This particular epithelium, at later stages, as we learned earlier, at later stages it becomes atrophic. Initially it is hyperplastic. Short of flat reticulus. So here these reticulus, you can see these are either short or it will be completely flat. Juxtaepithelial hyalinization. So juxtaepithelial means just beneath the epithelium. There will be hyalinization just beneath the epithelium. Fibrosis with dense bundles of collagen fibers in connective tissue. In this connective tissue, you can see these bundles. Fibrosis. Narrow blood vessels. Then there will be focal connection of inflammatory cells. Obviously, there will be inflammatory cells which will be present over here. There will be collection of inflammatory cells. Degeneration of muscles in severe cases. In severe cases, there will be degeneration. You can see the muscle over here. There will be degeneration of muscles. Let's look at the histopathological classification given by Pinbock, JJ and Sissat FM in 1966. And they were the first to divide OSMF depending only on histopathology. Okay, so they divided it into 4 stages. One is very early stage, moderately advanced, and advanced stage. And the classification, system of classification, I had shown you initially. There were like many based on clinical, histopathological, and both. So if you want to look at all the classifications, I will be leaving a link in the description. You can go and have a look. So what is the very early stage? Finally, fibrillar collagen dispersed with marked edema. This is a picture of fibroblast. It's not that important. I just put here to just have a clear idea of fibroblasts, how they look like. Then there'll be blood vessels are dilated and congested. तो blood vessels जो होंगी dilated नजर आएंगी और congestion नजर आएगा. So there will be inflammatory eosinophils are found. So these are the inflammatory cells, different types of white blood cells. This is neutrophils, eosinophils, basophils, lymphocytes. But in the first stage, you will see polymorph nuclear. These are the polymorph nuclear cells, and occasionally eosinophils. Next is early stage. In early stage, just the epithelial area shows early hyalinization. ये तो यहाँ से hyalinization शुरू हो जाती है early stage से. Collagen still in separate thick bundles. Moderate number of plump young fibroblasts. Dilated and congested blood vessels. Inflammatory cells are primarily present. Inflammatory cells are primarily lymphocytes, eosinophils, and occasional plasma cells. In very early stage, we saw polymorph nuclear leukocytes with occasional eosinophils. Here you'll see occasional plasma cells and mainly lymphocytes and eosinophils. Plasma cells are also the modified form of B lymphocytes. Moderately advanced stage. Collagen is moderately hyalinized. What we saw in early stage was early hyalinization. Here, collagen is moderately hyalinized. Thickened collagen bundles are separated by slight residual edema. Early stage में collagen was like in separate thick bundles. और moderately में thickened collagen bundles which are separated by edema. Fibroblastic response is less marked. Blood vessels are either normal or compressed. ठीक है, तो अर्ली में हमने देखा they were dilated and congested, और यहाँ पे हम देख रहे हैं blood vessels are either normal or compressed. Inflammatory exudate consists lymphocytes and plasma cells. तो अब यहाँ पे eosinophils नहीं है, यहाँ पे है lymphocytes and plasma cells. Next is advanced stage. Collagen is completely hyalinized. Okay, the advanced stage है यहाँ पे पूरी तरीके से hyalinize हो जाता है. Collagen smooth sheath with no separate bundles of collagen is seen. Edema is absent. कोई edema नहीं है. Hyalinized area is devoid of fibroblasts. ठीक है, initially fibroblasts young थे, cytoplasm बड़ा था. Early stage में moderately present थे fibroblasts. Then moderately advanced में fibroblastic response was less marked, और advanced में fibroblast नहीं दिखेंगे. Blood vessels are completely obliterated or narrowed. Inflammatory cells are lymphocytes and plasma cells. तो इसमें भी lymphocytes and plasma cells है. Moderately advanced में भी lymphocytes and plasma cells थे. और अर्ली स्टेज में lymphocytes, eosinophils थे, occasionally plasma cells थे. Very early stage में occasionally eosinophils थे, mainly polymorph nuclear leukocytes. So this is the histopathology, and the reason behind these features will be learning in etiology. So thank you for watching, and we'll be covering etiology and management in the part 3.